Hi, my name is Todd, if we haven't met before. Have you ever stumbled into really difficult conversations? I recently have um, patient going through cancer treatments and he's asking you they should continue taking the treatments or not. So unfortunately in home care, we have to have those difficult conversations with patients and family members. And, these conversations, they're oftentimes a matter of safety, compliance. There's a lot of emotion in it. And also, if they have learned to trust you, then, what you say would, really mean a lot to them. Um, some of the hard things that come up in home care is when you're dealing with a very poor diagnosis and things aren't looking good. Maybe addressing some unrealistic expectations about their recovery, that they think they might recover, but it's not going to happen. And then maybe discussing non-compliance with treatment, where the patient's just not going along with the treatment and their health is going downhill. Or maybe telling a family member that their loved one needs a higher level of care than the home health nurse can provide. Maybe stepping, out of the home care into the hospice, navigating requests that are outside of your scope. Sometimes, especially family members that are alone and they're wanting you to watch the patient while they run out and take care of some errands and things, and that's you want to say yes, but if you cross over those sticky boundaries, then you get yourself in over your head, and it just turns into a real mess. And then refusing unsafe environments or care situations where they just don't want to do what's safe, or they don't want to do what's more helpful for them. Some principles to kind of move you along on these difficult conversations is you kind of have to develop the right mindset for this. Of course, staying calm, being curious about trying to find solutions for them, and of course being compassionate. That's probably the foundation of it all. And a lot of times it's easy to kind of take things personal, but if you can separate yourself from that and remember that they're often scared, and sometimes they're even hostile because it's very stressful for them, dealing with this. But using empathetic, clear communication. Some of the things I try to remember is use the I statements. I want to, you know, help make sure your mom is safe at home, and here's what I'm doing to try to help that situation out, or reflect upon their concerns. You could probably say something like, well, it sounds like this has been really overwhelming for you, and I'd like to see what I can do to kind of help you out with that. And then also being clear on your role. Um, as your nurse, I can provide you with care, but I can't provide 24-hour care. That's home health is not set up for that. But being willing to connect them with some resources that are able to do that. As you move into the hospice arena, they can provide um, more care than home health can as their condition deteriorates. Um, Tips for staying professional under pressure, of course, is taking a deep breath. Just kind of slow down, and sometimes silence can be the right answer. Sometimes they just need to vent, they just need to get things off their chest. You can also ask open-ended questions to kind of help de-escalate a situation that's becoming more intense. And then also during these difficult visits and times, it's very important to document everything factually and clearly. When emotions do run high, you know, you have to recognize that there's going to be some guilt, there's going to be some grief, there's going to be denial and anger involved with the situation. It's common. It's what they go through, and we're not here to fix the problem, but just acknowledge and validate to them that the situation does exist. And sometimes you can say, you know, it's okay to feel upset. This isn't easy, and share, you know, common um, body language that exhibits that you're trying to be caring, and have an open posture and stay calm and have a nice calm tone of voice. And then, you know, end with encouragement and resources. um, that's probably the biggest thing that I find myself doing is, you know, be reassuring and as best you can. And these conversations can get easier over time as you encounter these more. Then you'll gain more experience, and you'll, you know how to navigate them better. um, and also just recommend scripting or rehearsing if you're going to practice going through some of these, you know, difficult situations, you know, beforehand, just to, so you're not completely, you know, caught off guard, excuse me. um, Certainly would like to invite your thoughts or your comments on the subject. It's never easy to deal with stressful situations, and trying to deal with them as best you can. Um, and probably the biggest thing, just reiterating that there's a lot of resources out there. Fortunately, our company has some additional resources, and they're very helpful. Um, Sometimes they have a medical social worker that will, you know, come out and give them resources to help make the transition easier. And so, anyway, if you got this far, I appreciate it. And if you have any thoughts or comments, I'd like to hear about those. And we'll see you on the next one. Have a good day.